All right, you guys, thanks a lot for coming in. Sanjay Shah, Dr. Sanjay Shah. We're going to discuss facet mediated pain. So basically what happens is when you have low back pain, the low back pain can come from many areas. It can come from the facet joints, it can come from the disc, it can also come from the multifidus muscles, which are muscles in the spine. Today we're going to talk about facet disease. So these are the facet joints in your spine. You can see that there's joints on every level of the spine. These are joints just like any other joints in your body. The knee joint, the hip joint, they have cartilage in between the joints, and the cartilage can become inflamed, it can become arthritic, and it can cause a lot of pain. The pain is basically in the lower back. It can radiate to the thighs. We call that posterior thighs. We call that referred pain. So what we do is we can do facet injections where we go right into the joint, or we can do medial branch blocks. This nerve over here, this is called the medial branch nerve. That supplies the facet joint. If we block those nerves, we can block the pain impulses that are emanating from the facet joints. And then we can do what's called a rhizotomy, a medial branch rhizotomy. The rhizotomy is where we actually ablate this nerve. Ablate means to heat the nerve. So we actually heat this nerve to 90 degrees centigrade and for 90 seconds, and basically putting this nerve out of commission. So now by putting this nerve out of commission, you're taking the pain impulses that are generated from this facet joint, you're taking those out. What we do is first do diagnostic blocks, where I would go right where these nerves are at different levels depending on your pain and where your pain is. I would select the levels, but we'd go right where these nerves are. We put some numbing medicine, some lidocaine, kind of like you go to the dentist's office, you get some lidocaine, it numbs you for a little bit. We put some lidocaine there as a diagnostic block. That'll give you some pain relief for about maybe 3 or 4 hours. Once we do that, then we know if you get pain relief, the pain is coming from the facet joints. Once we do that, we can then ablate the nerve using special needles. First, I'm going to show you exactly what the medial branch nerves look like on X-ray. I'm going to go over here. You can see over here I have placed needles right on the medial branch nerves. You can look at it on X-ray and you can see where the needle placement is. We're going to block those nerves. We're going to put numbing medicine right at the level of those nerves, 6 nerves in total. And we're going to see how you feel in a few hours. If you get pain relief, then we know that this was a positive test. And if it's a positive test, what we're going to do is then use the rhizotomy needles. The rhizotomy needles are special needles. This is what they look like. The tips of these needles actually get heated up with our radio frequency generator to 90 degrees centigrade. We heat it up for 90 seconds, same positions that I put these needles at, and you will get pain relief anywhere from 3 months to 2 years.